So for scenario number 1 with Mr. D, who he had surgery on his left hip and he has an IV in his right arm and a bandage on his left hip, and he also has a Foley catheter. So his bed setup in his room once he's being transferred out of the PACU would be the bed rise to the height of the stretcher as an open surgical bed, and if needed, you would move any furniture out of the way so the stretcher can fit nicely next to the bed and nothing is in the way of moving him. And on his bedside, you'd need anything to take his vital signs, and you need a flow chart and like anything for documentation. And you'd need, since he does have an IV, you'd need his IV pole next to him, blankets for warmth, if he needs oxygen, or if the doctor says he needs oxygen, then you have his oxygen next to him, and he'd have a bed protector and an emesis basin, and a washcloth next to him and towels. If an adductor pillow is needed, you'd have that. If not, you could have regular pillows for comfort and for repositioning. And then you would document on the flow sheet. You would document what it looks like. We're on a surgical site. We can't change bandages, but you can document if there's blood or any kind of discharge going through the bandage that you can see, so you can notify the nurse immediately so they can change it. For the Foley catheter, if it's full and it needs to be drained, we can drain it or make sure it's clean, and along with his IV site, make sure that's clean as well. Document any changes in his skin around the IV, if it's red, inflamed, if he's telling you anything's bothering him about it. And same thing for his hip. You document his words exactly about if it hurts, how, like, I use a scale, a pain scale, to see how much it hurts, and you would document what it looks like and anything else he says, words, like his words exactly. I'm not sure if I mentioned a bed protector. I think I did. For his Foley catheter, you need the bag for the drainage to go into, and that's what you would check to see if it's full. Yeah, I believe that's all for scenario 1. If you don't need anything else by the bedside, I'm pretty sure. Yeah, and that's all you need for scenario 1.